My name is Alison Clarke and I'm a perinatal loss midwife. Perinatal loss midwives are specialists in providing care for families when a baby is stillborn. This includes supporting parents in options for investigations to help them understand why their baby has died. Investigating why your baby was stillborn is an important part of the care that both you and your baby will receive. The investigations may give you answers, and they may help the care that both you again. However, they do not always find the reasons as to why your baby was stillborn. Even when a cause is not found, important information can be gained and can help reassure you about what didn't cause your baby's death, and most importantly, that you didn't cause your baby's death. Not every stillbirth needs to or should be investigated in the same way. Your individual circumstances will determine what type of investigation will be most useful and acceptable for you and your family. Investigations that are recommended include blood tests for mum, an examination of the placenta, and an external examination and x-rays of your baby. Other investigations that may be available for you are an MRI or a CT scan. These are special scans that can be done of your baby's body. Another option that's also available for you is an autopsy. We understand that you want to protect your baby's body and do what's best for them. And this can be one of the hardest decisions for some parents when their baby dies. In many cases, an autopsy gives you the best chance of finding out why baby died. Whatever your decision is, we are there to support you. You can keep watching to hear more information about an autopsy.
Hello, my name's Jane Dahlstrom and I am a perinatal pathologist. A perinatal pathologist is a specialist doctor who is trained specifically in perinatal autopsy and is an expert in studying diseases of the placenta. My job is to try and help find out why your baby died. I would like to share some information about the autopsy examination to help you with your decision. An autopsy is a medical examination of a baby's body. This is performed by a specialist doctor like me. A full autopsy involves the most detailed examination of a baby's body, combined with looking at the placenta and yours and your baby's medical records. In a full autopsy, a careful incision is made on the front of the baby. Another incision is made over the top of the head. In a limited autopsy, an incision is made only in a specific area to be examined. This also allows the options for some areas to be excluded from the examination. For instance, if you prefer that your baby's head, brain is not touched, then this can be excluded. This may give less information than a full autopsy, but in some cases can answer specific questions. An external autopsy involves examining the outside of the body and may include photographs being taken and a range of imaging techniques as appropriate. No incisions are made, but this still allows us to look for obvious abnormalities and assess your baby's growth. This information can also help make sense of what we found when looking at the placenta. If you choose to have an autopsy for your baby, they may be away for about 2 to 3 days, but this may vary depending on your location and the day of the week. This is because the autopsy is a highly specialised procedure and is always undertaken by a pathologist who is an expert in this field. So in most cases, this cannot be done at your local hospital. When your baby is returned, they will look and feel similar to how they did before the autopsy. You won't be able to see any incisions when they are fully clothed, including a cap. You will be able to cuddle and hold your baby. Autopsy findings take time to be understood and interpreted. The final report should be available about 8 to 12 weeks after the autopsy, but this will not always be the case. A preliminary report may often be available a few weeks after the autopsy, and this also includes a lot of information. With other investigations, you may have answers sooner. Some parents choose to have an autopsy, others do not. Whatever you choose, your decision will be understood and respected by your healthcare team. Please talk with your midwife or doctor about what is best for you, your family, and your baby, and do ask any questions that you may have.